Good afternoon, everyone. Welcome back to your state capitol. Governor Kate Brown here, and very pleased to be here with you this afternoon and to see Judge McShane's ruling in Oregon versus Azar. He issued his formal preliminary injunction today. At my request, Oregon became the lead plaintiff in this case because the Oregon Health Authority administers our Title X programs and directs resources to providers across the state. Title X funds enable our low-income and our rural women to access critical health care services across the state. We are very, very pleased with the outcome. It will ensure that women across the country will continue to receive the health care they need and deserve. It's really up to strong leadership at the state level to ensure that healthcare access continues across the entire United States. And of course, given the chaos and incompetence at the federal level, it's really key that states step up to protect our values and our citizens from federal policies that are designed to achieve short-term political gains. And with that, I'm very happy to turn it over to our Attorney General, Ellen Rosenblum. Come on up.
Thank you, Governor. This gives me a chance to thank our governor for your unwavering support of this lawsuit and for your commitment to protecting access to reproductive health care for low-income women. Thank you.
Thank you.
We have both been hoping for the day when we can say that this ill-considered rule will not be going into effect anytime soon, and it really feels good to know that that is true. And I want to also thank our wonderful partners at Planned Parenthood, the Oregon Medical Association, and the American Medical Association, and all of the 21 states that joined together in this lawsuit, in particular our co-lead New York Attorney General Tish James. Today's ruling by Oregon's Federal District Judge Michael McShane is a significant victory, not just for Oregon, but for all women in the United States. This nationwide injunction means that the Trump administration's cruel and arbitrary Title X gag rule will not go into effect on May 3rd, as HHS, Health and Human Services, that federal agency, had hoped, as that would have been the formality of 60 days after issuance of the rule. Doctors and medical providers around the country who work in Title X clinics will not have to censor what they say to patients or tell patients who ask for information about an abortion that they are not able to provide them with that information. Indeed, the Title X rule proposed by the President is madness, as remarked by the judge in his opinion. And through this lawsuit, we were able to help stop this madness. To give you a flavor of Judge McShane's 32-page opinion, he states in part, at best, the final rule is a solution in search of a problem, and it disregards the health outcomes of women, families, and communities in the guise of program integrity. The gag rule prevents doctors from behaving like informed professionals. It prevents counselors from providing comprehensive counseling. It prevents low-income women from making an informed and independent medical decision. At the heart of this rule is the arrogant, it's still the judge talking, by the way. At the heart of this rule is the arrogant assumption that government is better suited to direct the health care of women than their medical providers. It is significant that Oregon was not alone in this lawsuit. What was so powerful is that we were joined, as I mentioned, by 20 other attorneys general, including New York and again the American Medical Association and Planned Parenthood, which the AMA and Planned Parenthood, a companion lawsuit the same day that we filed our lawsuit, and they were both heard at this preliminary injunction hearing last week. So we're very proud of this partnership, and it's an example of the work that state attorneys general have been doing together throughout the country along with other partners over the past 2 years. So last Tuesday in federal court in Portland, we were able to successfully outline to Judge McShane the harms that the Title X rule, if implemented, would have on low-income women. And included in our lawsuit were 36 declarations from public health policy experts from each state that joined us, from medical organizations, from doctors, and from Title X providers. And these sworn declarations of fact made a lasting impact on the judge. As he writes on page 3 of his opinion, the harms outlined in the record before me, should the final rule be implemented, are extensive and are not rebutted by the government. A review of the scores of declarations lead and this is him talking still, to the inescapable conclusion that the final rule will result in negative health outcomes for low-income women and communities. Now, last week, a federal judge in the state of Washington and a judge in California agreed with Judge McShane and independently from one another granted injunctions. The California injunction is not, at this point, a nationwide injunction. That's my understanding, but the Washington one is. California's applies only to the state of California. So this means we now have 3 federal judges on record as saying the Title X rule is essentially illegal. So what separates our lawsuit from Washington or California, you might ask? Ours, in addition to being joined by other states, 21 in all, is the most encompassing because Planned Parenthood operates in 48 states. And of course, the American Medical Association has member physicians who practice and reside in every state in the country. So as Judge McShane's ruling today lays out, there is ample evidence regarding the potential harm to the public health of not only the plaintiff states, but the nation. So that is why he decided, after deliberating over the weekend, to grant a full nationwide injunction. So again, thank you, Governor, for standing up for women across this state and across our country. It feels really great to know that we have made a lasting impact for women seeking comprehensive health care.
Great, thank you. Good afternoon. My name is Lisa Gardner, and I'm the President and CEO of Planned Parenthood of Southwestern Oregon. We are so proud to be part of this landmark decision to block the Trump-Pence administration's Title X gag rule. And I first want to thank our Governor Brown. Thank you so much for being a tireless leader for reproductive health care and always having our back at Planned Parenthood. General Rosenblum, thank you for partnering with us on this. And of course, the OMA and AMA as well. As a result of this ruling, nearly 50,000 Oregonians and about 4 million people nationwide will continue receiving life-saving breast and cervical cancer screenings, HIV testing, STI treatment, and affordable birth control. This decision from Judge McShane recognizes the incredibly harmful prospect of gagging healthcare providers and limiting their ability to provide full and accurate information to patients. This is a victory for patients who rely on Title X and for the many people who work in Planned Parenthood health centers. Planned Parenthood is proud to have challenged this unethical rule every step of the way, and today's ruling is wonderful news. Judge McShane's opinion perfectly outlines and recognizes the harm that this rule could have on health outcomes and for the patients most in need of care. For now, providers can continue to provide truthful, comprehensive, and non-judgmental information and health care, including referring their patients for abortion. However, this is still a temporary reprieve in the form of this nationwide preliminary injunction. At a time of rising mortality and escalating STI infections, politicians need to stop attacking women's health care. Instead, work with doctors and public health leaders to increase access to health care. Planned Parenthood will never force our clinicians to withhold medically accurate information from our patients, and will continue to fight the Trump-Pence administration in courts and in Congress to safeguard our patients' health and rights. Thank you.
Good afternoon. My name is Courtney Dresser. I'm with the Oregon Medical Association. On behalf of the Oregon Medical Association and our over 8,000 members, I want to thank the other plaintiffs and the governor for their leadership on this. We are so proud to be part of this important case. The federal rules which this case was based would have acted as a gag order on physicians and would have instructed physicians as to what they can and cannot say to their patients. This is counter to the code and the oath that our physicians base their practices on. It is in which it is vital to communicate fully with their patients. Patients should be informed of all their healthcare choices. Judge McShane's ruling was correct, and that the results of the federal rules would have had a negative effect on our patients. We applaud the ruling, and we hope that the Federal Department of Health and Human Services will reconsider these ineffective and harmful rules. And again, we're very proud to stand here with you. Thank you.
Thank you. I like it. I won't speak for the others, except for the Attorney General. I think we're both willing to take questions, and she obviously can answer the nitty-gritty details of the lawsuit, so.
Governor, you proposed money to go to these sorts of lawsuits. Is this sort of situation, Oregon taking the lead on something that is a bigger issue in Oregon, what you kind of envisioned?
Well, I think it's critically important that the states step up and protect the rights of our citizens, and having access to the full complement of reproductive health services is part of that. And so that is what I envisioned in asking for more resources, frankly, for the department to be able to take the lead or participate in lawsuits like these.
Where is the legislature's funding of that?
I think they're still in the budget, still working with the co-chairs. I'm meeting with the tri-chairs later this week. Anything else?
I don't know whether this is for you or for the Attorney General, but could one of you explain the gag order for people who may not know what it is?
You wanna do it?
What it would have done?
I'll do my best. Thank you, Dick. So we call it the gag rule. That's, of course, not what it's officially called, but it's a rule that was issued as a part of the Title X work that HHS has been doing. Primarily, it would appear to be really very politically motivated to try to prevent funding from going to those family planning clinics that have anything to do whatsoever with abortion, whether it's purely counseling or whether it actually is the provision of abortion services. The gag rule, the reason it's called the gag rule is that it literally gags doctors and other medical professionals from being allowed to talk to their patients about abortion as even an option. They literally are not, or barely allowed to mention the word. The only way, and in fact, they're required, even if the patient tells them that they wish to obtain an abortion, they are required to send them for prenatal services. And they are required to provide them only with a list of services that they can't say whether or not any of the doctors or any of the clinics would provide abortions. They can give them a list, and then the patient can go try to figure out whether any of those, if any, provide abortions. That's the way in which they are gagged. They are not allowed to provide information, and it is in fact an ethical violation for doctors and other medical providers to not provide their patients with this information, with full information about their options. And the ACA specifically provides that all information needs to be provided in a non-directive way, I should add. And what that means is that you can't direct a particular type of outcome. It means that you have to provide a full panoply of options, just like you would expect when you go to the doctor, no matter what it is you're there for.
I just have to do a follow-up. I wasn't there, Dick, when the case was argued, but my understanding is that Judge McShane likened it to you going in or another male person going in to get information about a vasectomy and instead being referred to family planning.
Correct. Thank you, Governor.
For the AG, you mentioned the ruling by the federal judge in Washington State last week, and you mentioned the AMA and Planned Parenthood. But does this ruling today differ or go beyond somehow that ruling by the federal judge in Washington State?
That was a full nationwide preliminary injunction, just as ours is. But of course, it's subject to appeal, and I think that the main difference is that the record is different, given the fact that the parties are different in the two cases, and of course, the record is going to be different. Our declarations are, as I indicated, extremely comprehensive as to doctors, as to the Planned Parenthood clinics, and as to the effect on all 21 states. Each of our states has provided declarations. So we feel that we have a very strong record. I can't speak to the record in the Washington case. I'm sure they've done an excellent job. My colleague Bob Ferguson is fantastic, as we all know. And that case, of course, it was only Washington is the only state, just as California is the only state. But there is an organization, you'll have to tell me what it stands for. It's called NIFRA. That is a co-plaintiff in Washington, and that encompasses a lot of the family planning clinics around the country.
Okay, got it.
This ruling was pretty scathing of the proposed rule change, and went so far as to even say that Judge McShane believes that the states will prevail on this lawsuit. What did you think when you got the written opinion going through it?
Thank you for the question. Well, you know, a preliminary injunction does have to make certain, it kind of has to reach certain thresholds before it can issue. And the first one is that the plaintiffs are likely to prevail on the merits, which means we haven't won the case. We still have to go on and present our case fully, but we are likely to prevail, and that's why I said that it appears that the judge is satisfied that the conduct is illegal. It also requires irreparable harm, a finding that there would be irreparable harm if the law were to go into effect on May 3rd, if the rule were to go into effect. And so I was a little bit concerned last week because the judge seemed to potentially maybe have some reluctance about issuing a nationwide injunction, but I think he just was being very cautious and careful and wanted to go back and consider all of what he had heard in the arguments, and I was feeling pretty good that at the end of the day he was going to see it this way, because there was really no way to say, you know, these states should not be gagged, and these states should be, particularly when we have doctors in every state and when we have Planned Parenthood in, I think, 48 out of the 50 states.
Could either of you speak to how the new HHS rule would have primarily affected lower income women?
Well, I think the short of it is that we would be extremely limited in our ability to provide resources to the providers that provide services to those women. Nationally, it looks at about 4 million women. In Oregon, probably thousands, but it would be for rural and low-income women wouldn't be able to access the full complement of reproductive health services. And it includes screenings for mammographies, gynecological exams, and it includes screenings for HIV. It obviously includes family planning services as well.
And I would just add to that, the 12 Planned Parenthood clinics in the state provide 40% of the Title X visits in our state, so our not participating in the Title X program would be a huge barrier to access.
What happens now?
I assume there's going to be an appeal. I'll let the Attorney General talk about that.
Yeah, of course, we're not the ones who would appeal. We were very happy with the ruling. So there had been, some legal machinations over the weekend. Of course, now that we have this new order, it remains to be seen what the government will do, the federal government, that is. So we'll keep you posted there.
Governor,
I think that's all the time we have for questions, sorry.
may I ask just one, please? There's a political question that I think will come up connected to this in the legislature, and that is, you support this ruling, but you also support HB 3063, the vaccination bill. Those people would say that takes away choice, and here you are supporting choice. And I'm just anticipating what they might say on social media and those things after today's press conference.
I think I would say, at least in terms of this lawsuit, is that it's absolutely critical that physicians and medical providers across the country be able to provide medical advice, healthcare advice to their patients without any type of limitation by the federal government. I think the same would be held true with House Bill 3063 as well. That it's critically important for physicians in the medical community to be able to provide advice to their patients, and 3063 does not restrict that.
Great, thank you, Star.
Thank you very much.